cell disease is a group of inherited red blood cell disorders. This affects 70 to 80,000 Americans. People can live full lives and enjoy most of the activities that other people do. Joining me is Dr. Jack with Anthem Hills Pediatrics to talk to us more in detail about sickle cell disease. So thank you, Dr. Jack, for joining us again.
Thank you.
So I kind of want to talk about sickle cell disease. What exactly is sickle cell disease?
Sickle cell disease is an inherited blood disorder that causes anemia. People with sickle cell disease have something called hemoglobin S, and hemoglobin is the oxygen carrying part of the blood. Now, what happens with the hemoglobin S is because it's abnormal, it causes the red blood cells to sickle and block small blood vessels so that organs and tissues don't get oxygen and blood. It's usually diagnosed by a test called hemoglobin electrophoresis that tests for the hemoglobin S.
So how common is sickle cell?
So it's more common in people of African and Mediterranean descent, and according to the NIH, it affects 1 out of every 500 African Americans and 1 out of every 1,000 Hispanic Americans. So there's the sickle cell trait and then the disease. So for a child to be affected by sickle cell disease, both parents have to have either the trait, so that's having the trait without the symptoms, or the disease.
Okay, and it's not life-ending, correct?
No, it's not. Health maintenance typically starts with early diagnosis, preferably in the newborn period. And now with the advent of the universal newborn screening, we can do that. And like with any other chronic disease, they're best managed in a multidisciplinary setting, and they go on to live full lives.
So how do parents know? Like, what steps can they take to research maybe on their own before they get pregnant or after they get pregnant? How do they know?
They can always speak to their healthcare provider if they have questions, but a good resource to have is the Sickle Cell Disease Association of America.
Okay, perfect. Well, thank you so much for joining us and telling us a little bit about sickle cell disease. I appreciate it.
Thank you, Megan.
Thanks.